Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is September 1. The City of Madison is launching its unarmed first responder program called Community Alternative Response Emergency Services, or CARES, to respond to mental health-related calls instead of the police. Joining us today to explain how it works is Chase Stedman, Assistant Chief of Medical Affairs with the City of Madison Fire Department. And thank you so much for being here today.
They're happy to be here.
Just to start, how does this new program embedded within the fire department instead of law enforcement work?
Yeah, so it's a 911 service. So any EMS, law enforcement, or fire-related calls that come through 911 all get triaged to the appropriate resource, right? As that system works, this is just an extra resource. And this particular team has a community paramedic from the fire department and a crisis worker from Journey Mental Health that can respond to non-violent behavioral health-related emergencies that come through the 911 center.
And so how do you decide if a call is answered by this team or by police, especially if time is of the essence?
Yeah, so the 911 dispatchers and the call takers in the 911 center are really integral to this, and they've done a lot of training around it. And this is something that luckily they've already done. You know, they are very aware of the questions that they need to ask the people that are calling 911. And to send that right resource. And they've been doing that for decades and decades. Now they just need to make sure that this team follows a particular set of protocol questions, such as, with the behavioral health emergency that's going on, is there any danger involved? Are there weapons involved? Is there somebody on scene that's being violent? And if any of the questions are answered to the necessity of having law enforcement there because of some sort of violent situation going on, then law enforcement will still be sent in first to make sure that that scene is safe. If the information from the 911 caller is that, yes, this is a safe situation, but there is somebody having a behavioral health emergency, then they'll just send this crisis response team or CARES team directly to the scene. So the 911 center is a very important partner in this, and it's really just them still doing the same job that they've always done with just this extra resource that's available to them.
And what exactly are the first responders, this team of two, doing when they respond to a scene?
Yeah, so fortunately, the information from the 911 center and the questions that were asked there all get loaded into a computer-aided dispatch system. And so all of that information shows up on a computer that the responders have available to them, so they can kind of see what the information is, kind of know what they're walking into. And their job really is to initially de-escalate the situation and make sure that they provide an appropriate intervention. And whether that's a behavioral health intervention on the part of the Journey crisis worker or some sort of medical assessment that needs to be made by the community paramedic, those folks at the scene can make the decision which protocols to follow, which intervention is most appropriate. And really, most importantly, with programs like this around the country, we're finding that people that are in some sort of mental health or behavioral health crisis, they tend to not want to see folks walking in with guns, right? And so no matter how good a law enforcement is at their job, no matter how good they are at de-escalating a scene, just the presence of somebody in uniform, somebody with a gun on them, can exacerbate the situation. So our responders that come into this situation are not in any sort of formal uniform. They're not responding lights and sirens in a big fire truck. So we hope that initial de-escalation is possible. And then after that, it's really providing the appropriate intervention for the person at that time. And even then, referring them to the appropriate mental health resources in the community. So we can actually work with them on scene, but also drive them to the appropriate facility specific to their needs.
And so if it's needed, will there be a possibility of, in some cases, officers intervening after this team of two of mental health responders get to the scene and maybe things change?
Yeah, certainly. If they're unable to de-escalate the situation, or if there is any sense that there is something illegal going on, then of course law enforcement resources would need to be brought in. But the intent of the team is to not have these people that we consider to be patients, right, that need more help on the medical side and behavioral health side, and hopefully keeping them out of the law enforcement world in general if they're not needed there. These folks don't need to be contacted and set down a path towards jail when the path really that's going to help them is towards a mental health intervention. So at any point, a law enforcement officer can call this team and have them come in. This team can call a law enforcement officer, have them come in. And it's the same on the medical side. If our paramedics are out visiting with somebody that really doesn't have an acute medical problem, but they have something more low level that is also a behavioral health issue, our paramedics in the field can call the CARES team to come in and make that intervention so that the person can have a continuum of care that's better than the paramedics just saying, well, you don't need a transport to the hospital, so we're leaving, goodbye, have a good day, right? We're offering this kind of extra care that takes the person downstream. We can give them a warm handoff to the appropriate mental health provider and then have that referral take the person to where they need to be.
What was the impetus for bringing this to Madison? And is the model that you're implementing based on programs already put into practice in other cities?
Yeah, great question. So we've been looking at those other models here at the fire department for a good 4 or 5 years. Specifically, the models that we've researched the most were the CAHOOTS program in Eugene, Oregon, and the STAR program in Denver. There is quite a few around the country as well that are operating successfully. So the impetus really was that although we knew these programs were effective, we finally got some money in the budget this last year. One of our city alders, Alder Arvina Martin, was big in the initial support and kind of having the talk with the fire chief, Steve Davis, about this last year. We got support from the mayor's office and the Common Council, and they were able to budget approximately $500,000 for this team annually. And the hope and the vision of this team is that they will be able to grow. Right now, our little pilot program that we're running is just being run in the Central Police District of the city of Madison. So it's basically from the Yahara River to Park Street. And we're only running it Monday through Friday from 11 a.m. to 7 p.m. And so the vision is to have a team that works 24/7 throughout the whole city and eventually, hopefully, the whole county. But yes, researching those other programs were key. They give us a lot of really good information about the right things to do, the things that we shouldn't do, how to evaluate our program over time using data. So yeah, those other programs that are successful out there have been a great help.
City data says that Madison receives roughly 7,000 mental health related calls per year, 20 calls per day, and primarily answered by law enforcement. Would this program be aimed at alleviating some of that stress on law enforcement? And is it also meant to prevent unnecessary injury or death to someone who needs mental health services by a police officer, as we have seen in a lot of media reports over the last year and a half?
Yeah, so there's certainly going to be a reduction in stress on law enforcement because of this. And that's kind of a side effect of us taking over some of these calls for them. And so the hope is that, if we look at harm reduction studies and the right path for people, we hope to, divert people from the criminal justice system. We hope to divert people from emergency rooms too, because the hospital emergency rooms can become overwhelmed with folks that don't necessarily need emergency room services. So, we're looking at just making our whole 911 system more appropriate. So it relieves stress on the folks that don't need to be part of this situation. And really, we want to be patient-centered. We want to do what's right, provide the right intervention at the right time for folks in behavioral health crisis that don't need law enforcement and don't need emergency rooms.
How is this different from crisis intervention teams or having mental health specialists that are part of law enforcement teams?
Yeah, it's similar. The big key here is that we're trying to bring a team that doesn't have a law enforcement officer, and so we've had a lot of questions around safety. Is this team going to be safe? How can you assure their safety? And the fire department in general, we respond to a lot of calls on our own. And so when we come to a scene and we recognize an element of danger, whether it's a weapon or anything else, we're trained to de-escalate the best we can, back out of the scene, and call for law enforcement backup. And so that's what this team is trained. That's why there's a fire department paramedic on this team, so they can kind of keep that umbrella of safety around the team when needed. But looking again at these other programs around the country, we find that when the 911 center is doing their job appropriately and sending this team into a situation that is as safe as they can tell that it is through the 911 call, that doing this without law enforcement should be a good model, but we always have that law enforcement backup if we need it. And because that fire department paramedic is there with their radio and the safety training that they've had and the de-escalation training, we expect that this team will hopefully be safe and be able to operate in a manner that will really truly help our patients.
While you were helping to implement this program, what did you hear from public input, and how is it specifically tailored to the Madison area and Madison needs?
Yeah, great question. We did quite a few listening sessions. We talked with not only community members, but mental health providers in the area. We talked with University of Wisconsin Mental Health Services, because they're kind of in our jurisdiction as well. So we really spent the few months before we went live really getting out and talking with folks about, what the needs of the community are and what best practices were according to providers. And every state and every city has different state statutes and different ordinances. And so there's certain things that are done in Eugene, Oregon that we can't do here. For instance, around emergency detentions. And that's something that a law enforcement officer has to be involved with in the state of Wisconsin by statute. So if somebody needed to be put in custody, in protective custody under an emergency detention, we have to have a law enforcement officer on scene. The great thing about the city of Madison and Dane County in general is that we have a lot of resources. Social services are strong here. So the one thing that we're mostly hopeful about is that we really believe that we're going to be able to take the situations that we encounter and connect those folks with some sort of service that's going to be appropriate for them. We were very thoughtful about making sure that our team was diverse. We actually extended out our hiring process for our new community paramedics because we wanted to see hopefully some more people of color applying, and we were fortunate in getting a bilingual Spanish speaker as one of our community paramedics, and both of the Journey crisis workers identify as people of color. So that was also very important to us to make sure that that we had a team that represented the community. That was some of the feedback that we had gotten. Other feedback from the community was please don't show up with badges and uniforms on looking intimidating. So we decided to put them in civilian type clothing. And we gave them a lot of de-escalation training, a lot of extra crisis response training that these community paramedics needed. As 911 paramedics, we don't get a lot of training around mental health response in our basic paramedic class. So we sent them to a 40-hour class through NAMI, a crisis intervention training. That's a nationally certified course. We also sent them for de-escalation training, motivational interviewing, and a number of other courses that are designed specifically around mental health. And of course, the two Journey crisis workers are both master's level crisis workers, and so they bring a lot of expertise to the team as well. So yeah, depending on what county and what state you're in, teams may look a little bit different, but we really did our best to model ourselves after those best practices that are out there.
Sometimes people don't want to call police officers in a certain situation, fearing the ramifications of making that call. Will this encourage people to reach out for emergency assistance that might not normally otherwise?
I sure hope so. We've done our best to get the information out there about this team. If folks are nervous about calling 911 because of the possibility of law enforcement showing up at their home, that's unfortunate. I personally, have worked with our police department here in Madison for 25 years and have faith that they do the right thing, and that they've been specially trained to handle mental health calls. But I certainly understand why folks don't like somebody wearing a gun walking through their door in these situations. So, I hope that as this team shows success over the next few months and we collect data showing that patient satisfaction is there and that we're actually really helping people, we'll get more funding to expand the team out and provide these services, like I said earlier, to the entirety of Dane County And the more this team can respond to behavioral health crisis and keep law enforcement doing the things that they need to do on the law side of things, I think it'll just work out best for everybody in the community.
Now, it's worth noting today is the first day of the pilot program. So what are your short-term goals? What are your long-term goals? And how are you measuring success?
Yeah, great question. And yes, you timed this interview very good today. We just started at 11 a.m. today for our very first day. So the measuring success is a tough one. It depends on who you ask, right? Because if we're being as patient-centered as possible, it's really about getting patient satisfaction surveys and following people downstream through their referral to make sure that they're still engaging in services. And so when we looked at the evaluation criteria from those other successful teams, it was things like fewer calls that the police department had to respond to, fewer people getting sent to emergency rooms and jails because of crisis responses, and most importantly, patient satisfaction around the treatment that they received. So we have a data analyst assigned to us from the City of Madison that's going to be pulling all of our patient care reports, both from Journey Mental Health and from the fire department, looking at all the data, accumulating everything that they can possibly together, and then presenting that to the mayor's office and public health, and to have them evaluate it and kind of let us know if we should be shifting directions or not. So short term, my goal is to keep our teams safe and keep them responding and helping people. And long term, it's going to be likely fighting for money to expand our team.
All right, we leave it there. Chase Stedman, Assistant Chief of Medical Affairs with the City of Madison Fire Department. Thank you. Good luck with your first day and keep going. And thank you for your work. Thank you so much for joining us.
Thank you very much. I appreciate it.
For more from Here and Now in PBS Wisconsin, you can visit pbswisconsin.org/news. And thank you so much for joining us on Noon Wednesday.